everybody another minute to get settled. Well, let's get started. Good morning and welcome to this virtual briefing about the official launch of the not-for-profit Addiction Alliance of Georgia. My name is Nick Motu and I'm Vice President and Chief External Affairs Officer for the Hazelden Betty Ford Foundation. I'm joining you today from our headquarters north of Minneapolis. I'll be co-facilitating the briefing and also speaking about this exciting new partnership between Hazelden Betty Ford and Emory Healthcare. Thank you all for being here. In addition to members of the media, we invited community members who have supported this venture since the beginning. Two quick logistical items. Number one, please make sure you are muted unless I call on you. And number two, please submit questions anytime via the Q&A button at the bottom of the screen. In your questions, please also indicate whether you are a journalist or another community member. We'll start answering media questions first in about 20 minutes, and then we'll get to any additional questions we have from other community members. With that, I'd like to introduce my co-facilitator, Dr. Mark Rappaport, who chairs the Department of Psychiatry and Behavioral Sciences at Emory University School of Medicine and is Chief of Psychiatric Services at Emory Healthcare. He and I have been the leads for our respective organizations throughout the planning of this partnership, and we'll kick things off with a few overview slides.
Well, thank you, Nick, for the introduction, and I'm looking forward to our slide presentation now.
Thanks, Mark. This is the Addiction Alliance of Georgia logo. As you can see, it's co-branded with Emory Healthcare and Hazelden Betty Ford Foundation sub-logos. That is not to suggest that we are going to be without community partners, because as we go forward here, community organizations will join the alliance. But again, it's co-led and co-sponsored by Emory Healthcare and Hazelden Betty Ford Foundation. Next slide, please. We started back in 2018. Frank Boykin, who's on the call, and Tom Johnson, who's also on the call, conceived of the idea of an Emory partnership with William C. Moyers, who's on our staff here as an executive. In 2008, we assembled a nonpartisan group of community and professional leaders to discuss the rising addiction rates and possible solutions in the Atlanta metro area, outskirts of Atlanta area, and also outstate Georgia. We also did a cooperative analysis of the status quo, what was needed, what services were already available. And then we had discussions, very intense discussions on a regular basis, starting back in 2018. We organized into committees and met on a weekly basis. This is a very unique strategic partnership, but again, it was inspired by Frank Boykin and Tom Johnson, two community leaders in Atlanta. Next slide. The Addiction Alliance of Georgia will be fueled by donor support. I mentioned earlier, we are a nonprofit, but the Alliance combines the strengths of Emory and Hazelden Betty Ford to reduce addiction rates, improve recovery rates, and save more lives. We are executing this strategy by executing tactics in three buckets. The first one is clinical care. The second one is community outreach and provider education and training. And the third bucket is research. I think early on, we recognized the strengths of both organizations, and these areas of focus naturally outflowed from the very beginning as areas that we wanted to focus on. Next slide, please. We early on identified 400 plus community organizations that we could collaborate with. We reached out to some of them, and specifically, we have worked with Judy Fitzgerald within the state government to identify gaps in current prevention and treatment services, and also identified ways that we could, as two private nonprofits, really collaborate with the public sector to develop strategies. So this is intended to be a private public venture. As I said, we looked at the needs of 400 community partners, including Georgia's recovery community organizations. Also a need that surfaced was the requirement that we advocate for people who need treatment and support services, including addressing the issue of addiction stigma. So with that, Mark, I'll turn it over to you.
Well, thank you, Nick. Next slide, please. So I'm going to focus a little bit on some of the education and workforce development aspects of what we hope to be doing. One of the first places we're going to start is with Emory Healthcare, and we're doing that for a couple of reasons. One is because Emory is a very large both provider of healthcare, but also it is the largest academic health system in the state of Georgia. And so we want to beta test out the best ways of providing addiction-related education and training to physicians, to PAs, to nurses, to nurse practitioners, to students on the undergraduate campus, as well as students in the graduate programs, and key personnel throughout Emory Healthcare. We also want to ensure and figure out the best ways using Emory Healthcare as a beta test site of rolling out appropriate clinical protocols for care, and particularly education about medication-assisted treatment. Can I have the next slide, please? Our goal is to partner throughout the state of Georgia with the other universities, with other healthcare systems, the Medical Association of Georgia, the Nurses Associations of Georgia, the psychologists and social work groups in Georgia, as well as the drug courts, recovery organizations, in order to facilitate the development throughout the entire state of Georgia, realizing that a large part of our state is rural. Statewide capacity. We're going to continue our currently ongoing training at Grady of behavioral health professionals. We'll also continue our work in Fulton and DeKalb counties. We're excited about the idea of partnering with the community service boards throughout the state of Georgia in order to facilitate the development of medication-assisted treatments and state-of-the-art treatment as has been pioneered by Hazelton Betty Ford. We're very fortunate in this effort to work not only with the community service boards, but throughout the state of Georgia with the Georgia Department of Behavioral Health and Disabilities. We're also fortunate to work with the CDC. And in fact, the CDC has been generous and actually given us two interprofessional agency partial slots so that we can begin those collaborations. And we're really looking forward to partnering with the public sector to identify and fill gaps. the goal is to leverage innovative models also so that we can do real-time consultations throughout the state of Georgia, so that if there's a practitioner who's in rural Georgia that needs some of our help in Dahlonega or someplace, they'll be able to reach us through teleconsultations and real-time work with experts. Next slide, please. So what's phase one of this project? It's to expand outpatient services for people in Georgia. It's to launch an intensive outpatient program that will be centered at Emory initially, to create a virtual intensive outpatient program, to introduce a partial hospital program here in the Atlanta region, and do so in a way where we incorporate all the wisdom of Hazelden Betty Ford, their proven models and systems of care, their wonderful outreach systems that exist that facilitate a seamless sort of transition when a patient calls to appropriate placement. Then in phase two, next slide, what we intend to do is to build near the Emory Brain Health Campus a large residential treatment facility for people with substance use disorders that will again be a nonprofit that meets the needs of people throughout Georgia. As part of this, we will also have a detoxification facility that will be linked to the Brain Health Center and to this residential treatment facility. Next slide, please. So what's next? We're going to continue to secure funding to support the Addiction Alliance of Georgia. We're going to extend our current outreach and education and prevention activities in Georgia. As a spoiler alert, we're already looking at some really innovative school-based approaches that we hope to launch in the very near future. But one of the most important things that we're going to do is really engage in a statewide listening campaign with the recovery communities, with families in the state of Georgia, and others, to better understand the needs that exist here in Georgia right now and how the Addiction Alliance of Georgia can partner to fill those needs. And we're going to, of course, continue our discussions with state government and community partners. Next slide, please. And in fact, in order to demonstrate this commitment, I now have the wonderful pleasure of introducing Judy Fitzgerald, who's our commissioner of the Department of Georgia Department of Behavioral Health and Developmental Disabilities, and who, as others have indicated, has been a wonderful partner from the beginning. Judy has carved out time from her busy schedule for over 2 years to actively engage in the development of the AAG and be one of our initial partners. Judy?
Thank you, Dr. Rappaport and Nick. It is so rewarding to see this unique partnership come to fruition at a time when it's needed in Georgia more than ever. The Georgia Department of Behavioral Health and Developmental Disabilities is honored to have been a part of this vital problem-solving dialogue since the very beginning. This collaboration ensures that we are training medical professionals in the private and public sector, extending access to state-of-the-art clinical practices across sectors, and offering hope to individuals all across Georgia. Throughout these conversations, I'm really excited to tell you that there has been a very concerted effort to leverage every federal dollar to support education, awareness, reducing stigma, providing treatment, and supporting recovery so that there's no duplication of resources. I want to commend the thoughtful, passionate, and strategic leaders at Emory University and Hazelden Betty Ford Foundation. And I want to thank them for their vision and their persistence. I also want to thank the courageous voices of community leaders like Frank Boykin and Tom Johnson, whose energy and whose persistence sparked action. I have no doubt that this is an unprecedented partnership that is going to have a measurable impact across communities in Georgia. And I'm so grateful to be a part and to have our team be a part of this really exciting initiative. Thank you.
Thank you very much, Commissioner Fitzgerald. And again, Judy, thank you so much for your partnership and leadership that you bring to everything that we're doing here.
Thank
It
you.
is now my pleasure to introduce Dr. Patrice Harris. Dr. Harris is a psychiatrist and an adjunct assistant professor in our Department of Psychiatry here. But more importantly, Dr. Harris has been both a local, regional, and over the last decade, a national leader on health policy issues, and particularly issues related to the opioid crisis. Dr. Harris?
Well, thank you, Dr. Rappaport, and good morning to everyone. It is certainly my honor and privilege to have been a thought partner on this journey from the very beginning to what is now the fruition of this wonderful work and partnership. Since 2014, I have chaired the American Medical Association's Opioid Task Force, and I have had the privilege of touring this country and looking at what works. And certainly the AMA has also highlighted the need for access to treatment. The data are clear. We remain in the midst of an opioid epidemic that is evolving. In fact, we use the term overdose epidemic. And of course, this is on the foundation of, again, inadequate, long-standing inadequate access to treatment. That access or lack thereof is amplified for those who are uninsured and underinsured, and for those from communities of color, and also for children. And so I'm so happy to see there will be a focus on potential school-based partnership. As a child psychiatrist, that's very exciting for me. But today marks a commitment. Partners, both public and private, are not just talking about the problem here. These partners who have been engaged and involved are acting. And action is needed now more than ever. So this is a great beginning, and I look forward to the work ahead. And I also want to congratulate Emory and Hazelton and Frank and my good friend Tom for your persistence and for your leading us to what is going to be a critically important journey.
Thank you, Dr. Harris. Next, I want to introduce Tom and Frank to the group. Tom Johnson is the former CEO of the Los Angeles Times and CNN, and Frank Boykin is the current Chief Financial Officer for Mohawk Industries. We're grateful to have both of them here to share a few brief words. And I've got to say, from a personal note, without Tom and Frank, we would not be here right now. As I said earlier, they were the inspiration early on for bringing Emory and Hazelton Betty Ford Foundation together. And during the project, they were actively involved in the committee work and the discussions, and really formed an important link between Emory and Hazelton and the community. So with that, Tom, would you say a few words, please?
Thank you very much. I want to thank everybody who is part of this call today, but more than that, I just want to thank especially the leaders of Emory Healthcare and Hazelton, who really, without whom we would not have this historic announcement. A special thanks goes to, I believe, the community leaders here in Atlanta, Frank Boykin and his wife, Karen, and to the families of who have experienced the tragedies of substance use disorders. I mean, the painful experiences. 2.5 years ago, a nonpartisan group of us gathered to discuss the crisis, especially the rising number of deaths from opioid overdoses. We resolved then that we would do what we can do to fight this battle. Since then, and particularly with the coronavirus, since then, the number of alcohol consumption deaths, drug use, suicides have increased sharply. We have what many have called an epidemic, a drug epidemic within the COVID-19 pandemic. Now, William Cope Moyers, who is on this Zoom, son of Bill Moyers, a recovering addict himself, and almost like a son to my wife, Edwina, and me, brought the leadership of Hazelton Betty Ford Foundation to Atlanta 2.5 years ago, where they met with Dr. Rappaport, Dr. William McDonald, and Dr. Justine Welch, among others. So here we are, 32 months later, after dozens of Zoom meetings, hundreds of emails, off-site meetings. I think the group chose even, Palm Beach, or Palm Desert, I guess, for that meeting, but very careful studies. It's just been an extraordinary amount of research. Announcing this alliance will really do so much. First of all, hopefully it will help to get the word out throughout the state, but we will be at work on prevention, research, education, treatment, and recovery. And now the excellence of Emory University, led by my friend President Greg Fenves, and the excellence of Hazelton Betty Ford under President Mark Mishik, will create what I predict. I'll make this prediction with confidence today, will become a world-class center, one that will save many thousands of lives and return thousands more to healthy, productive citizenship. We will need your help to do it, especially funding from foundations, from corporations, and philanthropists. And I'll just conclude by paraphrasing President Carter. He said, "We have limited time on this earth to try to make our world a better place." I am confident they will do just that with the Addiction Alliance of Georgia. And now, my friend, and really the founder, Frank Boykin. Frank?
Thank you, Tom. Thank you, Tom. I never dreamed 2.5 years ago when you and I met at the OK Cafe, and I told you about my son's struggle with addiction, that we would end up where we are today. Tom, I want to thank you for your commitment and your drive to bring our community to get together with Hazelton Betty Ford and Emory to put together this very important project. I also want to thank Mark, along with his team at Emory, and Nick with the HBFF team, Hazelton Betty Ford team, for all of your hard work. This venture, I believe, has the potential to be a model for other communities across our country and around the world to address addiction. I'm proud to have been a part of this effort, and look forward to the good work that this venture will accomplish. Thank you very much.
Well, I want to thank both of you. I want to thank you, Frank, and you, Tom, for all the time, all the energy, all the passion you've had, and the guidance you've given us. Frank was in meetings with us many, many hours every week. And Tom, of course, has really driven our fundraising in this effort. So thank you guys very much. And now it's my pleasure to introduce 3 other people that are going to participate in our panel today. The first is Dr. Marv Seppala. He's the Chief Medical Officer of Hazelton Betty Ford, and he's a nationally regarded expert in the treatment of opioid disorder and other substance use disorders. The second person I want to introduce is Dr. Justine Welch. Dr. Welch is head of our addiction services here at Emory and has done really wonderful work establishing not only an adult program in addiction, but also a program for youth in addiction as well. So she's a noted educator and researcher, as well as clinician in the area of substance use disorders. And of course, William Cope Moyers. And as Frank and Tom have said, we wouldn't be here without William's work bringing both groups together. William's a national recovery advocate and a best-selling author, and really has been critical to this. So, Nick, do we have any questions for this august panel?
Yeah, I'll just remind everybody on the phone, especially the media, and we're going to take those questions first, and then open it up to the community members to ask questions. Please enter your questions in the Q&A within the Zoom platform here. But the first question I've got is for Dr. Marvin Seppala and Dr. Justine Welch, and that is, and Tom Johnson, by the way, referred to this earlier as an epidemic within a pandemic. We're seeing accelerating rates of SUD, not only nationwide, but in Georgia specifically. So Justine and Marv, can you address what's happening in the Emory community and in within our organization, Marv, related to the pandemic and its effects on what we're seeing internally?
Be glad to, Nick. I'll start out. You know, we're seeing our folks who answered our phones when families and patients call for admission are describing remarkable dysfunction and despair among the people calling for help in a way that they've never seen. And we know across the country there's been increased substance use. Alcohol and other drugs are increasing pretty dramatically. And there's data that suggests the overdose rate, which peaked last year at over 72,000, has increased as well. So what we believe is that we're seeing a dramatic increase in substance use and the consequences of it. At the same time, because of this pandemic, that resources that are difficult to access even prior to this pandemic are limited. Multiple treatment programs are going bankrupt across the country and unable to provide care because of the pandemic. In our system, we've been able to stay open in our residential programs, but also shift all our outpatient programs to virtual setting to continue to provide care. I think of addiction as a hidden crisis within this pandemic. When you look at the access, when only 1 in 10 people can access treatment that needed it last year, the main factors have to do with both stigma and knowledge. People don't know anything about this illness and don't know they have it, and there's so much stigma in the way of just seeking help. I don't know, Justine probably has a lot more to add to this. I hope so.
That was well said. I guess what I would add would be that here in Georgia, the Department of Public Health said in a recent alert that the United States is really facing 2 concurrent national public health emergencies, both COVID-19 and drug overdoses. Here in Georgia, they highlighted that overdose-related emergency room visits in the state have escalated since the pandemic. And from March through June of this year, compared to the similar time period just before the pandemic, there was actually a 9% increase from all drug overdose deaths. In patients at Emory, we are really seeing an escalation of substance use, and not just in individuals who may have relapsed, but also in people who are completely new to treatment. This is one of the main reasons now that we are really pushing virtual services in response to the pandemic and really the dramatically increased demand for acceptance of this type of care.
Thank you, Dr. Welsh and Dr. Rappaport, or Dr. Seppala, I'm sorry. This question is for Dr. Rappaport, and this comes from Maria Saporta, a journalist. How much do you estimate it will cost to launch phase 1? How much has already been raised and committed? And what is the estimate for phase 2, especially the inpatient center? Also, is CHOA going to be part of this partnership?
Sure. You know, thank you very much for the neuropsychological test. You know, a question with so many multiple components to it. Let me start with the last part. Yes, CHOA, our partner in terms of child mental health and child health, will certainly be involved in what we do. And we're very much looking forward to our partnering with CHOA around this. In terms of the costs, the cost for phase one is estimated to be about $10 million. Thanks to the wonderful work that Tom Johnson has already done, I'm proud to announce that we have $1 million worth of pledges there. $5 million of this 10 million we need will go towards the development of clinical programs. Another 4 million will go towards the development of the education and outreach programs that we described. And then $1 million will be used to fund the initial seed research necessary to really kick off what we're doing there. In terms of the second phase, which is really exciting and unique, this partnership will require about $40 to $50 million in order to create a world-class residential treatment facility and detox facility. But we are excited about it. We've already begun to have talks about it internally, and we're really looking forward to this moving ahead. Nick, do you have anything to add?
No, we're very excited, and we all think here, and I think you share this, Mark, that we will quickly achieve our first year development fundraising goal to fund the first activities. And by the way, I also will mention, and you mentioned this earlier, we have an oversight committee operating almost as a board of directors, and we've already been allocating funds out of some of that $1 million to fund prevention activities in schools in particular. So we are anxious to get started, not only in the clinical area, but also in the education and training bucket, and ultimately collaborating on research projects. The next question is from Jeremy Redmond, reporter for the Atlanta Journal-Constitution, and he wants us to elaborate on the Alliance's plans to launch an intensive outpatient program at Emory next year. What is this going to look like? What kinds of patients will be eligible, insured and uninsured, and how much would it cost them? And the same question about the partial hospitalization program. So I would ask Dr. Welsh and Mark Rappaport, Dr. Rappaport, to answer that or team up on that.
Sure. Justine, do you want to start?
Yeah, so let me take a first stab at the question about the intensive outpatient program. So the implementation of the clinical programming will occur in several phases, as Dr. Rappaport mentioned, spread out over 3 to 5 years. So our intent is to launch what we call an IOP, or the intensive outpatient program, within the first 12 months. We are currently looking at locating that IOP in a 9,000 square foot renovated space at Wesley Woods near Emory's existing adult inpatient psychiatric unit, which has easy access to public transportation. There will be small rooms and large meeting spaces, which we hope to create a welcoming environment in a private area on campus. Dr. Rappaport, do you want to answer questions about the cost and?
Sure. You know, at this point, we're not sure exactly about the cost for each individual, and it'll be very dependent on knowledge that we're gaining right now from our partners at Hazelton Betty Ford, as well as working with our Office of Managed Care and Insurance. However, both Emory and Hazelton Betty Ford are absolutely committed to providing services not only for enfranchised individuals and people with insurance, but also for people without insurance. This is a commitment that we have from the senior leadership of both organizations. Both organizations have done a lot of work in this area. In fact, in the last year, Emory devoted over $90 million towards charity care for either uninsured or underinsured individuals. I don't know if Nick, you or Marv would like to add to this.
Go ahead, Marv.
Yeah, I'd be glad to. So we are absolutely committed to this. The partnership's essential to our organization and to the care of people with addiction across the state of Georgia. And it's extremely exciting to have this opportunity and to look at how to go beyond an insured group of patients to those who really need the help that don't have such funds or support. And that's one of the reasons that Judy is involved in the state of Georgia from the very beginning of this, to ensure of that type of resources.
I think it would also be important for me to mention that one of our primary target areas within philanthropy is to be raising money for scholarships that we can provide for free treatment as well.
Thank you. Next question. This is for me, directed at myself and you, Mark Rappaport. In our opinions, what do we think will make this partnership most successful? I think, first of all, for me, it's over the last 2 years, we have built a relationship of trust between the participants here. We really work well together. And I think all of us realize that each organization has a skill set that makes it different from the other. So we complement each other's skill sets very nicely. Emory Healthcare is preeminent in the healthcare field, in the behavioral healthcare field. We are a leader for 70 years in the treatment of SUD and in the execution of prevention and education within schools and within communities. We complement each other very well with those two areas of expertise. And then in the area of research, we were have been very impressed with Dr. Rappaport's track record related to research projects and Dr. Welsh's activity in the area of research. And we think that is an area that will allow, again, for collaboration between the two organizations. We have what's called within Hazelton Betty Ford Foundation, the Butler Center for Research. And we concentrate on researching evidence-based outcomes internally, externally. And I think bringing together those professionals within our organization and within Emory will really result in some research outcomes that are really going to inform not only our ability to develop new protocols to treat patients, but also measure the effectiveness of what we launched together vis-a-vis the IOP, the virtual IOP, and ultimately the residential program. So Mark, do you want to add your comments there?
Yeah, I'll add a couple, but Nick, you did such a wonderful job. What really sold me on this project more than anything was on January 30th of 2019, a small group of us, Dr. Welsh, Dr. Ira Horowitz, who's the head of our physicians practice group, Sarah Brewer, and myself went out and spent time, a couple of days, with the leadership of Hazelton Betty Ford at the Betty Ford Center. What we saw there were a number of things. We saw a group of individuals, of people who shared the same values we had, who honestly cared more about people, more about treating people and families with substance use disorders than anything else. The values of the two organizations are similar and yet complementary. The quality of the people involved at Hazelton Betty Ford is phenomenal, absolutely phenomenal. And all of us at Emory have tremendous respect for the people at Hazelton Betty Ford. And I think all the people at Hazelton Betty Ford that I've met have such similar respect for us at Emory. And that's very, very important. So I think the people, the fact that both organizations share a value where caring for patients and family is number one, number two, and number three. And also understanding the strengths that we bring together in order to help the people of Georgia are the things that are going to make this really work.
Thank you, Mark. The next question is from Tracy Peer, 11 Alive News. Can you speak to the educational programs in schools? What ages, grades will have the programs? And I'll take that. As I mentioned earlier, we are already working with a local high school in the Atlanta metro area, and I'm not able to release the name yet, but we hope to have a prevention program installed in that school, and hopefully it'll be the first of many that really, address prevention and building resiliency among students in those schools. And so stay tuned. But our prevention arm is really driven out of what we call professional educational services within our publishing division. Our publishing division within Hazleton Betty Ford is the largest in the world. We not only publish recovery support materials, we publish treatment curriculas that are evidence-based, that are installed in many of the other treatment facilities across the country, in governmental agencies. Judy Fitzgerald has taken advantage of some of those curriculas already within the state of Georgia. And also prevention programs. We have up to, I think, 15 plus prevention curriculas, evidence-based prevention curriculas that we go into schools and install. And one of those, as I said, will hopefully this fall be installed in a high school. But going back to your specific question, Tracy, our programs in schools cover middle schools primarily, but also high schools. And then we also have materials for families that are struggling with abuse or SUD issues within their families that we distribute as well. So I hope that answers the question. Mark, did you want to say something?
Yeah, can you talk for a minute about that amazing program you have for children, at Betty Ford?
Yes, we have at Betty Ford and in Denver, Colorado, and on our campus here in Center City, Minnesota, we offer a children's program to children of those that are suffering from SUD, either in our treatment or within our treatment facility or not. And it's free of charge, and it's a week of immersive education for these kids, and it's wonderful. It tells them that their parents are not bad. This is a disease, and it really educates those kids about what their parents are going through. And it's a tremendous program. And again, it's offered free of charge. It's all donor driven from a funding standpoint. So, families don't have to pay for this. And, we hope to expand it outside of those three sites. But for now, it's offered in California, in Minnesota, and in Colorado. Ages, by the way, ages 7 through 12 is kind of the target audience for that program. So thanks, Mark.
Sure.
Next question. This is for Dr. Harris. How unique is a partnership like this from a national perspective? And that comes from a journalist. Dr. Harris?
Yes. Can you hear me and see me?
Yes.
Okay, great. Yes. No, there are some other public-private partnerships across the country. But what I've always said is each jurisdiction will have to find the best partnership, alliances, treatment opportunities that best meet their communities. You know, communities are different across this country, and so what I really like about this partnership is from the very beginning, there have been discussions about the needs here across, of course, Metro Atlanta and across Georgia, and a commitment to addressing treatment needs here. So there are other public-private partnerships, and I think the one as proposed here is going to be of great service to the citizens of Georgia.
Thank you. And I'll answer that from, by the way, also from the from the Hazelton Betty Ford Foundation's standpoint as well. We have partnered with other healthcare organizations, but never on a level as outlined in what you're seeing in this collaboration. This is truly a partnership and a collaboration, and it goes beyond collaborating on just single projects. For example, we have partnered with the Mayo Foundation here in Minnesota on individual research projects and other smaller initiatives and other organizations as well across the country that are healthcare organizations, but never to the extent of what this collaboration and partnership will give the community of Atlanta and the state of Georgia. Never. So I think it's unique from our 70-year history, from the perspective of our 70-year history. The next, Mark, go ahead, Tom.
If I could, I really would like to bring a very human element into this. Yes, it is true that when I first learned of Frank's experience with his own son, I had earlier lived through a very personal experience with a young man that I considered my other son. I considered him also probably the finest young journalist that I'd ever known as a writer, both with me and on the Dallas newspaper as well as at CNN. But I'd like just to get, in a way, how his experience in an Atlanta crack house led him to me, and to how that probably is how I really developed my greatest passion for this project. So if we could bring William Moyers in for just a minute, I think it's the human side of this. And incidentally, 2 nights ago, I had a call from a person who was in desperate need of treatment. And my first call was to William Moyers, and then second to Justine. And again, it gives you just, I think, a human perspective on what we are up against. So William, if you would.
Well, Tom, thanks. I'll just keep it very brief because I think Frank can also speak to this from his own family's perspective. But 26 years ago, hard to believe we've come this far, but 26 years ago, I was locked in the throes of a recurrence of my addiction to alcohol and crack cocaine. I was holed up, so to speak, in a crack house on the corner of Boulevard and Ponce Leon Avenues, not far from Emory. And I couldn't get out of there. I couldn't get out of my own free will. And I knew what the stakes were because I'd been in several treatments earlier. I could not get out. I was crushed by the stigma of addiction. I was shamed that I couldn't get my act together. And I wouldn't have made it out of there without the community of Atlanta. It's that simple. From my church to my employer, from Tom to my doctor to the pastor of my church, my own family. All those people came together, rallied around me, and did for me what I couldn't do for myself, got me back into treatment in Atlanta in 1994, October of 1994. And I think what's happening here is a direct reflection on the commitment of the entire community of Atlanta and Georgia, the state of Georgia, to help people like me, who need help and deserve help, sometimes more than once. So I'm just real grateful that this has happened. It's a reflection on what happened to me 26 years ago. And Frank, I think you can speak to that same sort of intimate family perspective that made a difference. So thanks.
Thank you, William. The last question from journalists, and then we're going to open it up to any questions from the community. But the last question from journalists relates to the MOU and kind of the contractual relationship that we have. When we announced the MOU earlier this year, we outlined the framework for the alliance, specifically what has evolved with today's launch of the alliance. And let me take a stab at that, Mark, and then you can chime in. Yes, we signed an MOU almost, it was actually over a year ago. On July 24th of this year, we signed contracts. And when I say we, the respective CEOs of the organization. So this partnership is memorialized by contract. It's a strategic alliance. We have set up governance structures within the alliance and within the collaboration. And it took a lot of time. Whenever you get the attorneys involved, it took a lot of time. But I think generally speaking, this is a strategic alliance framework. But again, it's intended to give equal voice and leadership authority to both organizations. And we've structured it that way in the governance. So Mark, do you want to add anything?
The only thing I'd add is that although this took a long time, what it really allowed us to do was really begin to form the culture of the Addiction Alliance of Georgia. And again, these meetings turned out to be a wonderful opportunity to really learn to work together and did nothing but enhance the respect and trust that we have in moving forward into what's really the next step, the first phase of what we're going to be doing together.
Right, I'll just add, I'll add one last thing on that question, Mark. I think you will remember this, but whenever we got into deep discussions on some of the details of the relationship from a contract standpoint, I think we all always reminded each other about our respective missions. And I think I could not agree with what you said earlier. I think our mission at Hazel and Betty Ford that guides everything is trying to get help to the people that need help. And I think our understanding from day one was that you shared that vision. And I think that superseded anything in our contract negotiations and trying to get this agreement memorialized from a legal perspective. So I hope that answers the question. So are there any questions now from the community?
I just want to mention that I received a private message from one of the journalists asking me about our commitment to the minority community, especially given the fact that Atlanta and the state of Georgia has such a very significant minority, both African American and Hispanic. I want to emphasize that Dr. Valerie Montgomery Rice, the president of Morehouse Medical, has been in consultation with me from the beginning. She intends for Morehouse Medical to be very much an integral part of our future going forward, and we will be reaching out to her and to others. We recognize the significant importance of serving and having participation from the African American and Hispanic community as we go forward.
You know, Tom, I think that's a very good point, and I think both of our organizations have been very much committed to this, and it is a very important part of our planning and what we want to do with the state, because it's not just for the people in the immediate Atlanta area, but it also is for the people in the rural parts of Georgia as well. And there are many underrepresented minority individuals throughout the state of Georgia that we hope to reach with this Addiction Alliance of Georgia.
And let me just add one other thing. We have already participated, thanks to Frank Boykin. Hazel and Betty Ford has, that is, even before this collaboration discussion started, and it was using our professional trainers to train Grady medical professionals to install what we call Core 12, which is a medication-assisted treatment protocol for opioid addiction. And Frank, can you talk about your experience and what prompted your involvement in that project?
Yeah, sure. When our son Stephen finally completed his 5th term in rehab at Hazleton Betty Ford and was introduced to buprenorphine, he's a recovered heroin addict. That was one of the main drivers for his recovery. And so my wife, Karen, and I wanted to give back to the community, and with the help of Hazleton, found this opportunity at Grady. And we're very proud to be able to participate in a small way.
And Dr. Grayson Norquist has been designated by Mr. Halpert, the CEO at Grady, to be the lead for the AAG partnership. And Dr. Norquist is actively involved in working with the all of the federally qualified health centers throughout the state.
Thank you. There's one last question, and this is directed to Commissioner Fitzgerald. Do you want to speak, Judy, to the gaps you are seeing that the state is looking to fill vis-a-vis this partnership and collaboration?
Yeah, thank you so much for the question. I really just want to underscore what I hope everyone is hearing out there, which is the importance of collaboration and communication, and why it's so important that public and private are coming together. And not only are these two world-class organizations coming together and partnering with the state, I hope you heard loud and clear, they're saying, we've got to listen. We've got to listen to what the needs are. We're going to have listening sessions. We're going to have community forums. They've asked our team, how do we find out what those needs are? And very importantly, how do we not duplicate efforts? We do see gaps. So my department, the Georgia Department of Behavioral Health and Developmental Disabilities, is the state authority. And what that means is we receive the federal grant funds, which most folks are aware year over year in the last several years, the federal government has invested in state services and supports. In Georgia, we really have focused on two important needs with our public dollars. One is this continued effort to raise awareness and reduce the stigma. It is the #1 barrier, just getting people to recognize that they have an illness, that recovery is possible, and that treatment works. So we continue to make investments everywhere around education and making it easy to say, where would I call? What would I do if I needed help? So raising awareness has been a really critical priority. And then the other big investment that we've made is for uninsured individuals and creating an infrastructure. What you've heard about, and Frank talked about his family experience, what we know is the evidence says that medication-assisted treatment works. For many people, there are many paths to recovery, but this is one that has not been available widely in the public sector. So with the federal dollars we received, we've made it possible for individuals who are uninsured to receive access to this treatment through our community service boards, who are public providers throughout the state. So this is so vital that we're talking with our private partners too, and making sure that what we're doing is opening doors to access. So we're really excited that we have one pathway that our partners here know they can make referrals to our services and supports, and we can do the same, because we certainly wouldn't want public dollars to be used where folks have insurance and other resources. So it's really in this collaboration that this unprecedented partnership, I think, is going to have the most meaningful impact across our state.
Thank you so much, Judy. Those are all the questions I have. Mark, I think we're ready to close.
Yeah.
Yours.
Well, I just want to thank all the participants. You guys are awesome. And so eloquent. It really is remarkable. I also want to thank Nick. And again, in closing, this is the beginning of what we're trying to build together. Not just, and when I say together, it's not just Hazelton, Betty Ford, and Emory, but as Judy Fitzgerald so eloquently put, it really is a partnership with everyone within the state of Georgia to provide prevention, to provide education, to provide care, and to perform research so that we can really advance new approaches to care for patients and families and prevent people from getting ill. You know, and if you really would like to learn a little bit more about this, the Addiction Alliance of Georgia is going to be featured on an upcoming Georgia Public Broadcasting show. This show is going to be on Monday night at 8 p.m. So it's after breakfast for observant people of Jewish tradition. It's a 2-hour special, and it's going to be wonderful, and it's going to feature many of the people that you heard today speak from the panel and from other sources. You can watch it on GPB, or you can see it on either the GPB website or the Emory Brain Health website. Those in the media, I think you have our press packages and release and contact information. We want to thank you very much for your time in joining us today. And to everyone involved in the kickoff. Okay, we've got a lot of work to do. Thank you, and I'm looking forward to doing it with you.
Thanks, everybody.
Bye.
Thank you. Bye.
Thanks to everybody.